Are you suffering from stomach problems? Hello, this is Takuya Health Lab. Today, let's learn about stomach and duodenal ulcers together. Before getting into the main topic, it is important to review a few basic points about digestion. Digestion takes place in several stages. In a very simple way, it all starts in the mouth, where food is mechanically broken down by your teeth. This is called chewing. At the same time, enzymes are released in the saliva, which helps start breaking down the food. The food then travels through the esophagus to the stomach. This brings us to the second stage, gastric digestion. In the stomach, digestion is both mechanical, thanks to the contractions of the stomach, and chemical, thanks to the release of hydrochloric acid and enzymes. The liquid that leaves the stomach then enters the small intestine, where digestion continues and nutrients are absorbed through the intestinal lining. After that, the remaining contents move through the different parts of the colon to reach the large intestine, which is the final stage before defecation, meaning the elimination of stool. So, what is a gastroduodenal ulcer? Here, we are talking about two anatomical structures: the stomach and the first part of the small intestine, called the duodenum. By definition, an ulcer is a loss of substance in the wall of the stomach or the duodenum, reaching deep into the mucosal layer. Why does an ulcer appear? An ulcer results from an imbalance between the aggressive effect of stomach acid, mainly hydrochloric acid, and the protective mechanisms of the mucosa at a specific point. There can be several causes for this imbalance. The most common one is the presence of a bacterium called Helicobacter pylori. This bacterium weakens the gastric mucosa and makes it more vulnerable to the acidic environment of the stomach. Other causes include the use of medications such as non-steroidal anti-inflammatory drugs, or the presence of significant underlying diseases. What are the symptoms? They can vary from one person to another, but in general, people experience pain in the upper central part of the abdomen, without radiation. This pain may feel like cramps or like a painful sensation of hunger. The pain is often relieved by eating food or by taking antacids. The course of the disease is often marked by flare-ups lasting a few weeks, separated by symptom-free periods that can last for months or even years, especially in cases related to Helicobacter pylori infection. Of course, there can also be atypical clinical presentations. How is the diagnosis made? First, there is a medical consultation with a specialist. A clinical examination, such as pain on palpation in the upper abdomen, can suggest the diagnosis of a gastric ulcer. The reference examination is an upper digestive endoscopy, which makes it possible to locate the ulcer and describe its characteristics. A biopsy can be taken at the same time to look for Helicobacter pylori. Other complementary tests may also be performed, such as blood tests or breath tests. What about treatment? The goals of treatment are to quickly relieve symptoms, heal the ulcer, and prevent recurrences and complications. The main complications include bleeding, narrowing of the digestive tract, and perforation. The standard treatment is based on eradicating Helicobacter pylori with antibiotics, usually combined with a proton pump inhibitor to reduce stomach acid. If medical treatment fails, and in rare cases, surgery may be indicated. This usually involves removing the lesion and treating any complications if they are present. I hope this helps. Stay healthy and take care. Thanks for watching. Today is the youngest you'll ever be, so take that first small step. Thanks for watching. Please like and subscribe for more useful tips.